to switch gears a little bit, and I'd just like to tell you a story about a patient because I think it's a good way to illustrate the kind of work that we do here. Stephanie's a young woman that we cared for here a number of years ago, and she gave me permission to tell her story to anybody who wanted to hear it. She was 16 when she started coming to the corner. She had developed type 1 diabetes when she was about 7 years old. She was referred to us actually by her pediatrician. When he called me, he said that Stephanie's diabetes had always been under great control, but as she moved through the teen years, it was controlled less and less well. And he told me, and she's smoking and drinking and cutting school and fighting with her mom. Her pediatrician is a pediatrician in the community, well-known, great guy, great doctor. We still have a great working relationship with him, but literally he didn't know what to do next. He said, "You're the experts in teenagers, take care of this teenager." So Stephanie established care in our clinic, and because we're set up to handle teenagers and the greater complexity that some of them have in their lives, we simply had the luxury of spending a little bit more time with her up front. And she wasn't smoking and drinking and cutting school. She had drunk beer twice with a girlfriend at the girlfriend's house from the dad's beer stock in the refrigerator. And she smoked one cigarette once with the boy who smoked that she liked, so she smokes a cigarette with him. And it turns out that she wasn't cutting school either. She would wake up in the morning and her blood sugars would be high and she'd feel terrible. And in Stephanie's words, "Whenever my diabetes gets bad, my mom goes crazy and she's irritating." So she simply wasn't telling her mom that she was sick. She just wasn't going to school, and this is being interpreted as truancy. So to take what was a more than a year-long, very long story to the shortest possible conclusion, what Stephanie really wanted was to act like a normal teenager, and the things she was doing was normal teenage rebellion. But it didn't fit very well with having diabetes. So the doctors worked with her. We were able to alter her insulin dosing schedule so that she could stay up late at parties and sleep late on Saturday mornings without worrying about having some kind of diabetic crisis. We worked a lot with her, teaching her what it actually meant. She was 7 when she was diagnosed, so all the teaching had been done with her parents. So we started over teaching her so that she could, like I said earlier, take responsibility for her illness herself. She worked with our nutritionists, who were amazing. Stephanie wanted to eat pizza and M&Ms with her friends, and the nutritionists were amazing at helping her figure out how she could do that responsibly, be a normal teenager, still have diabetes. And perhaps most importantly, she and her mother developed a really close relationship with the social workers who are our therapists here. The two of them, Stephanie and her mom, worked on their relationship. Stephanie's mom learned to step back a little bit, let Stephanie control things a little more on her own. And Stephanie was able to develop some insight into why she was acting out. And so it was all very successful, except for then Stephanie turned 18, and she was no longer covered under her parents' health care insurance. This is before the Affordable Care Act. I always want to call it the Affordable Health Care Act, and I know that's not right. So Stephanie was kicked off her parents' insurance. Because she was a patient here, and we care for uninsured patients, she could still see her doctors, but the insulin, the testing strips, the glucometers, those things are very expensive, and her parents didn't have a lot of money, so it was quite a crisis for the family. We tried to help Stephanie apply for health insurance on her own, but she had a pre-existing condition and she was ineligible to be insured. So I've spoken with Stephanie through the years, and she's fine. It was hard, but I'm glad to say that were we to have a patient in her situation today, because of the Affordable Care Act, she wouldn't be kicked off her parents' insurance at 18. And when she was in her 20s and was no longer eligible to be part of her parents' insurance, she would be able to access health insurance because of the provision that doesn't allow insurance companies, or at least makes available an insurance company that will accept you, even if you have a pre-existing condition. So obviously, I'm a huge advocate for teen-centered healthcare. Maybe not every teen needs it, but many teens can benefit from it, and we are here to provide it not just to low-income teens, but to any teen that has a need that we could help fill. not only is the grant helping us as a clinic, but it's had a really important concrete effect, positive effect for our patients and their parents.